So after discussing the snoring in the first and second section of our lecture, let's move on to the next topic of our today's lecture, and that's the sleep apnea. And in this we will discuss the different types of sleep apnea, what's the physiology, normal mechanism of breathing, and what's the abnormality that can occur that can lead to the sleep apnea. So physiology and pathophysiology of sleep apnea, consequences of obstructive sleep apnea. Sleep apnea is a disorder that is characterized by pause. Absence. A is whenever used anoxia, apnea. All these means absence. So in this case also a disorder characterized by pause in the breathing or periods of shallow breathing during sleep. So when the breathing is not enough, when it's not deep enough, or it's a pause or cessation of breathing during sleep, it's called the sleep apnea. And we already mentioned that when the mouth is open, there is obstruction. Soft palate cause obstruction that can cause the blockage of the airway, and when the mouth is closed, that obstruction is relieved. So something is happening during the sleep that is causing the apnea. Different types, we have obstructive type of sleep apnea, central type, and then the mixed type, in which we have both the obstructive and central type of sleep apnea. This is the physiology of the sleep. In the normal sleep, all these different phases occur, which we have when the person is awake and they are not sleeping, that's the waves that are achieved. Then we have non-rapid eye movement. Non-rapid eye movement, stage 1, that's the recording. Then stage 2, non-rapid eye movement. Patient is now, you can see the graph is becoming deeper and deeper. The breathing is becoming deep and deep, not shallow. So as the more rapid eye movement, now we have stage 3 and 4, more deep, and then rapid eye movement sleep, where we go to. So these are the stages or the physiology of the normal sleep. When the person is awake, then we have non-rapid eye movement, stage 1, 2, 3, and 4, and then the rapid eye movement sleep. Pathophysiology of obstructive sleep apnea. Now, what's happening if the patient have obstructive sleep apnea? Once the person sleep, the onset of sleep, then there is reduced pharyngeal muscle tone. So during the sleep, the pharyngeal muscle tone is decreased. That causes airway narrowing or collapse, reduction in airflow. Now hypoxemia and hypercapnia occur. There is intermittent hypoxia. Now increased ventilatory effort. Patients can increase the ventilation. They increase the effort to increase the ventilation. Now there is disruption in the sleep, arousal from sleep, increased pharyngeal muscle tone, and then airway opens, reoxygenation occur, and then there is sleep. So that's the pathophysiology of obstructive sleep apnea. Abnormality that occurs during the sleep, as the patient person fall asleep, there is relaxation of the pharyngeal muscle tone is decreased. This reduced muscle tone causes obstruction of the airway, and when the airway is obstructed, there is decreased intake of oxygen, increased build-up of carbon dioxide. This causes hypoxia, and then patient try to overcome that. They increase the effort, and then this causes disruption of the sleep. Person wakes up, and then again with the waking up, the tone is increased, and then cycle is repeated again and again. So that's the pathophysiology, abnormality lying behind the obstructive sleep apnea, causing hypoxia, hypercapnia, and this hypoxia increase the ventilatory effort by the person, and then increased ventilatory effort causes the disturbance of the sleep. Once the person wake up, there is increase in the pharyngeal muscle tone, and that comes again and again. That's the cycle. Consequences of obstructive sleep apnea. So there might be, depending on how long the period of obstructive sleep apnea, the consequences might be very, very severe, because we notice that there is hypoxia, decrease in the supply of oxygen that can affect the brain, that can affect the heart, that can affect the respiratory system. So all these different systems are affected. So there is block of airway during these obstructive sleep apnea, and the consequences associated congestive heart failure I mentioned, and cor pulmonale. That's the congestive heart failure associated with the respiratory failure. So with the obstructive sleep apnea, there is first the respiratory airway obstruction, respiratory failure, and this respiratory failure slowly affects the heart, and there is enlargement of the heart, congestive heart failure, the pumping of the heart is affected, and it can cause cor pulmonale. Polycythemia and hypertension, high blood pressure is present. Polycythemia is increased red blood cells, so that is also present. Atrial and ventricular arrhythmias and left heart failure. Rhythm of the heart is not normal. There is arrhythmia, absent of the rhythm, and there is left heart failure. Attacks of angina can occur because of decreased supply of oxygen to the muscles of the heart. There is chest pain associated with angina. So all these are very serious consequences of obstructive sleep apnea. Snoring, spouse syndrome, we mentioned, is another. Loss of memory, decreased libido, traffic accidents because of tiredness, sleepiness, all these problems can occur. Agitation, irritation, person is depressed because they are not sleeping well at night. All these complications are occurring. They have heart failure, respiratory problem, hypertension. So all that is changing the person's overall day-to-day life and behavior. So that was all about the section 3, in which we talked about the causes of obstructive sleep apnea and consequences of obstructive sleep apnea. Thank you for watching sqadia.com.